Hello everyone and welcome to part one of a series of short information videos developed by the Quality Improvement team aimed at helping you with your QI initiatives. Today we're going to go through some hints and tips for developing a smart aim statement. So when we think about developing an aim statement for our QI initiative, we are effectively thinking about question one of the model for improvement, which is simply, what are we trying to accomplish? This is the most fundamentally important question in the model for improvement, and without answering it effectively, our improvement efforts will not work. So today we're going to help you with that. It seems quite simple, but many teams fall into the trap of developing an aim that just isn't practical and doesn't really give a clear idea of what you are trying to achieve. To answer this, we need to develop a smart aim statement. We are regularly approached by people that have an idea for an improvement project, but they've just not been able to frame it effectively. Some examples can be seen here. I want to add a new checklist on Rio. I want to create a new recovery group. I want to do safety huddles. I want to create new guidance for physical health checks. Now, improvement takes place when there is a clear and firm intention. The aim statement defines what we are trying to accomplish and delineates clear, specific plans for the work ahead. It should include what is the problem or opportunity, how much will you improve by when will the aim be achieved, for whom will benefit, where, what are the boundaries, and where does it begin and end? QI works for complex solutions. If you know your solution will work, just implement it. But if that solution doesn't lead to any improvement, what do you do? When we have consultations with staff, we generally end up asking 3 questions. This helps us move from lofty implementation concepts to basically seeing if there is a quality improvement project. So if we take one of the statements that we saw on a previous slide, I want to do safety huddles. We need to determine whether or not there's a quality improvement project there. So the first question we ask is why? Why do you want to introduce a safety huddle? And generally the response we get is something like this. I read a paper that said that they can help reduce violence and aggression. It's a big problem on the ward. So really what we see from this statement is there's a problem with violence and aggression, or they want to reduce violence and aggression, and they see a safety huddle as a way of doing that. The next question we ask is, how will you know that you've solved the problem if you introduce the huddle? There'll be less incidents, calmer patients, staff will feel safe. So they're getting into measures here, they're thinking about how they're going to measure success. But then the next question we ask is, what if introducing safety huddles doesn't work? And generally the answer we get is, we don't know. So we're back to square one. Violence and aggression and its reduction is generally a complex problem, and that's what QI looks at, improving complex problems. So what we try to do is develop an aim statement and work out the quality improvement project from the initial solution. And we do this by asking our teams to fill in an aim statement template. So after answering the 3 previous questions, we then get teams to think about an elevator pitch. This is what you would say to someone, a senior manager, a service user, or a colleague if you had just a few moments in a lift between floors to engage them with your project. We ask them sort of, how are you going to use your aim to infuse and engage people and to get people involved with your project? And with their answers in mind, we get them to fill in the template. It asks for 4 questions: what, where, for who, how much, and by when. And it's all about reframing. So when we ask what is it you want to achieve? So we got this from one of the previous slides. They want to reduce incidents of violence and aggression. The where for who, for this particular project, would be on Rosemary Ward. Then we ask how much, by 20%. We mentioned that they need to be smart, aims need to be smart, and 20% puts a figure of improvement that we can measure against. And by when. So this is just where it becomes timely. So we're working within a time frame. And for this one, it's by April 2021. In completing this task, they've basically completed the development of a smart aim statement, and we just need to construct it. As you can see on this slide, we've reconstructed the words, and the aim for this project would be by April 2021, we aim to reduce incidents of violence and aggression on Rosemary Ward by 20%. This aim statement is smart, it's specific, it's measurable, it's achievable, it's realistic, and it's time-bound, and it allows them to focus on the project at hand. So some tips and hints. Be smart. Try not to include solutions in your aim statement, because if the solution doesn't work, then there's a bit of a problem. Set achievable timescales. 6 to 9 months for your project usually works. And remember, not many people get it right first time. If you're unsure, speak to the QI team and we can help you. As I've said, the emphasis is around improvement rather than a specific change idea. Your perception of what might work at the start of the project may be completely different by the end. It is important to understand the system first. If you want any more help, please email the team, the email's on the screen, or visit our Connect page. Just search Quality Improvement in the search bar, and you can find us on Twitter at BSMHFT_QI. Thank you very much.